Celine Nalwanga is the director of Mummy's Pride Montessori Nursery School in Kayunga, Wakiso district. The 50-year-old is the mother of 2 daughters who are living with sickle cell disease. At the age of 28, Nalwanga gave birth to her first daughter. Unfortunately, the family's joy was cut short when the baby started falling sick constantly and her parents decided to have her thoroughly checked. After several medical tests were done, the doctors diagnosed her with sickle cell disease, which is a genetic disease that affects red blood cells. She was put on medication and life continued normally. In Senior 2, she suffered a pain crisis which affected her legs. The doctors recommended the use of crutches.
I lost peace when she was given crutches. I took her to Dr. Nyero for daily exercises, and after some time, she recovered.
Nalwanga says that because of their daughter's condition and the fear it had created, they decided to wait longer before having another child.
Even her father felt very bad, and he told me, all children we are producing are useless.
Nalwanga says her husband's statement cut deep and this caused some tension between them. In 2013, her husband packed up and left the marital home.
The father doesn't understand what you are going through. He comes home, asks you for whatever you feel uncomfortable.
With her daughter's condition weighing heavily on her mind, Nalwanga decided to set up a school which she hoped would provide job opportunities for her daughters. It worked and has greatly eased her stress.
At least, my girl is sick. The teachers can handle the school. Let me take her to hospital.
Tracy Katusime, the older of Nalwanga's daughters, learned that she had sickle cell disease when she was 7. Her friends constantly questioned why she was frequently away from school, but she refused to tell them.
I had one friend, I told her, I used not to talk about my health status. So you told me, why are you always sick? I have malaria. Why are you always sick? Typhoid, flu, cough. So I put up stories. So this one day when I got the courage to tell this one person I have sickle cells, after telling her, I felt sick that same weekend and I went home. And then literally I came back home when this girl has spread the news all over.
The 22-year-old says that opening up about her condition helped her to get friends who love her as she is. She does acknowledge, however, that many adults do not understand the condition and act mean towards people with sickle cell disease.
Because sometimes even at the workplace, they stigmatize you unknowingly. Those people don't know that they're doing this. They just think, where they are being concerned, I don't even know. Because you fall sick, and then someone says you're being favored because you're the boss's child.
Ashraf Sebandeke, a sickle cell warrior and advocate, says that finding a partner is challenging.
You find families saying, okay, if the partner has sickle cell, don't bring them closer to our home.
The 34-year-old has spent 19 years raising awareness about sickle cell disease. His motivation stemmed from the stigmatization he endured during his high school years. At the age of 7, Sebandeke had suffered swollen legs and painful body muscles that prevented him from walking steadily and disrupted his studies. The doctors at Masaka Hospital diagnosed him with sickle cell disease. However, in 2009, when he returned to the hospital for more tests, they revealed that he was a sickle cell trait carrier.
So I'd just returned from home. I'd been sick, so I came back to school. I found when the fine art teacher had left behind assignment, so I couldn't write the assignment. So when he came, he asked for his assignment. I told him, I'm so sick, I can't write it. So what he did, he didn't listen to me. So he punched me in the head. He slapped me and even ordered me out of the class and confiscated my shoes.
Deeply saddened, Sebandeke walked out of the class and took the case to the deputy head teacher who knew about his condition. Unfortunately, he was not attended to and he walked out of the office in tears.
When I was walking, what was running through my mind was what happened to other people with sickle cell.
As the co-founder of Action Against SCD, established in 2017, Sebandeke emphasizes that despite their relentless efforts to educate people about the disease, Challenges like inadequate medical personnel to handle sickle cell patients in hospitals and limited resources are still a burden.
We want the government to include sickle cell in whatever they do. So it should be inclusive because we are here to stay.
He has also asked the government to introduce a policy that calls for mandatory sickle cell testing and screening. Katusime has proposed the provision of sickle cell counselors, especially in schools, for students who are living with this genetic disease. Sickle cell disease is genetic and affects the red blood cells in the body. The disease causes severe pain in some parts of the body, such as legs and fingers, among others. The Health Ministry data shows that about 250,000 people in Uganda are living with the disease, and 20,000 babies are born with sickle cell disease annually, of which at least 50% die before reaching the age of 5. Dr. Philip Kasiria, the head of Mulago Sickle Cell Clinic, says the facility has registered a mobile population of close to 20,000 since its commencement in 1968. On average, they have an active population of about 5,000 each year, and the daily population that ranges between 100 and 200 patients. The doctor says that although the Mulago Sickle Cell Clinic provides access to most of the medicines that are recommended for sickle cell care, including folic acid, painkillers, fluids, and hydroxyurea, among others, they need more.
The challenge is that they are not adequate because the numbers are unpredictable and they keep increasing.
He urges that there should be meaningful decisions when choosing partners.
Those who are not yet of age to be empowered and they make meaningful decisions to prevent. Why should we continue having children born with sickle cell anemia? And then we wait to say that there are not enough services.
As the world commemorates Sickle Cell Awareness Day today, the 19th of June, Dr. Kasiri has called upon communities, NGOs and all citizens to participate in the sickle cell campaigns that create awareness.